I'm Maggie McGrath, editor of ForbesWomen. Earlier this week, Vice President Kamala Harris announced that Minnesota Governor Tim Walz will be her running mate. Here to tell us a little bit about Governor Walz's record on reproductive health is Ruth Richardson. She is the president of Planned Parenthood's Minnesota Action Fund, and she joins us here to break down everything we need to know about his record on all things reproductive health. Ruth, thank you so much for joining us.
Absolutely. Thank you for having me.
So let's start broad. You are the president of Planned Parenthood in the Minnesota region. How has Governor Walz used his time in office to legislate on matters of reproductive health?
Governor Walz has been a great champion for reproductive health and reproductive freedom. After the Dobbs decision came down, Minnesota became the first state in the nation to protect access to abortion care with the PRO Act. And I think it was so important that when Governor Walz signed that bill into law, not only did it protect access to abortion care, it also protected the right to carry a pregnancy to term, to protect access to contraception, and access to IVF as well. And so he's been a real trailblazer within that regard. And he didn't stop with just protecting access to abortion care with the PRO Act. He also wanted to ensure for people who were traveling across state lines to get care, that those patients could be protected and doctors could be protected as well. And so signed a bill into law to ensure that they would be protected while they were receiving care, the Reproductive Freedom Defense Act.
Interesting. So when the Dobbs decision overturned Roe v. Wade in 2022, did he call you? Did he call your offices and get feedback on, how to legislate? Or take us back to that time. What was his leadership like in those days and weeks?
After the Dobbs decision, there was quite a bit that was going on because people recognized with the overturning of Roe v. Wade that by cutting off access to abortion care, it didn't just cut off access to abortion, it cut off access to health care. And so there were so many conversations in those days after the Dobbs decision around what was at risk, including increasing maternal mortality rates, infant mortality rates. And the reality is, fast forward, 2 years past that Dobbs decision, everything that was predicted to happen has. We've seen an increase in maternal mortality rate. We've seen increases in infant mortality rates. And what we have also seen is in states that have the most restrictions against abortion, they have the highest rates of maternal mortality and infant mortality. And in Minnesota, we've gone a completely different direction with Governor Walz and his leadership and the leadership of the legislature to ensure that we're protecting those things. And while other states were seeing infant mortality increase, we saw it decrease slightly. Still more work to do, but recognizing the importance of the legislation and the focus on protecting reproductive freedom in Minnesota is having the results that we want to see in those realms.
Interesting. So where we're seeing motherhood mortality and infant mortality rise in states with restriction, Minnesota, you say, is going in a different direction, and you would point to the legislation that Governor Walz passed. Is it specific to the Dobbs decision, or are there other pieces of legislation that he has introduced that have helped mothers and infants in Minnesota?
Yeah, I think it's important when we talk about protecting reproductive freedom, that means protecting access to many things. It means that we're protecting access to cancer screenings, STI treatment, and screenings as well, and also thinking about what it means to be able to carry a pregnancy to term in the best conditions. And so things like the Dignity in Pregnancy and Childbirth Act bill, that's another bill that Governor Walz signed into law to ensure that we're doing work to address the deep disparities that we see with the Black maternal health crisis and the Indigenous maternal health crisis, not only in Minnesota, but understanding that that's something that we are seeing nationwide, and also ensuring that we were protecting access to family planning services and increasing the dollars related to family planning as well. Because again, in states with the most restrictions, we're seeing STI rates skyrocket, and it's really great in Minnesota to know that while we still have work to do, that we're going in the right direction in terms of ensuring that there's access to essential health care.